Hello, and welcome to the Consider Your Mind podcast. I'm your host, Eric King, and along with my co host, Mino Pachan, we're here to talk about all things mental health. Let's get into it.
All right. Hello, everybody. Welcome back to the Consider Your Mind podcast, episode number 28.
Nice, man. Like Adrian Peterson, go
Yeah,
Vikings still.
all day,
Like
all day.
all day. Exactly.
Which is quickly off topic. It's going to be boxing at the end of the month, so that should be interesting.
Boxing? Who boxing?
He's boxing Le'Veon Bell.
Oh, you know what? I did hear something about that, man. That's crazy. I don't know
Yeah,
what Le'Veon is thinking. Why are you trying to
yeah.
box Adrian Peterson?
We'll talk a little bit more about that on the Let's Talk About
Mm.
It
Yeah,
on
that's a
Monday
whole nother.
nights. So,
threw me off.
but
That threw me off.
But today we're going to be covering Asperger syndrome and autism spectrum disorder. So we'll be covering a little bit about that. We'll start off with a little bit of autism spectrum disorder. So a quick overview. This is information we see that you can find out on Google and whatnot.
Mayo Clinic all day.
Yep,
You
Mayo
know.
Clinic has very great info in there. But on the autism
Mm.
spectrum disorder, a quick overview with that is it's a condition related to the brain development that impacts on how a person perceives and socializes with others, causing problems in social interactions and communication. So disorder also includes the limited and repetitive patterns and behaviors. So you're gonna see somebody, I guess you could say like who doesn't really read or know or take social cues.
Yeah,
So a
there
lot
you
of
go.
times you'll see
Exactly.
like awkward or anything like that.
Hmm.
So that's something that you can look up. We all know some people that may have some social cues that
Socially
they don't
awkward
get.
people. We
Yeah.
all know them. Some of
And
y'all
then
listen out there are them. So yeah, listen up.
right,
It's your episode.
right. At times it might be me. I'm just saying. But
Hey, for real.
some the symptoms, in some children show signs of autism spectrum disorder in early infancy, such as reduced eye contact or lack of response to the name or indifference to caregivers. Other children may develop normally for the first few months or years of life, but then suddenly become withdrawn or aggressive or lose language skills they've already acquired. Another one is each child with autism spectrum disorder is likely to have a unique pattern of behaviors and level of severity on
Hmm.
low functioning to high functioning severity scale, I guess they could say. But yeah, that's pretty much the
Yeah, man.
symptoms you can see. You want to dive in a little bit more on the autism spectrum disorder. Let
Yeah,
them
for
know.
sure. And the reason I wanted to do this, again, it's a little off the beaten path of, what we've been talking about, but not really in a way, because we've been talking about things that are just kind of misunderstood, mislabeled, you know. And one thing that gets, mislabeled is people who are socially awkward. And, sometimes we be very mean. Children are mean. And what do we call people like that? We still do it retarded. It's like you being a retard, you know what I'm saying? You slow, all this stuff that we do actually to people. And it makes those who actually, could be getting have an actual diagnosis on the of ASD, autism spectrum disorder. It kind of gives it that stigma so that they don't even wouldn't even want to get a test to figure that out, because it affects actually 1 in 59 children, so it's a lot more common than you think. And with that, it's not that researchers think that it's more common than it used to be. It's just that it's being diagnosed more than ever. So there's always been people on the spectrum, as they say.
Mm.
But it's just now that we have more information. Medicine's getting better. We're able to diagnose earlier and things like that. And so that's that I thought that was kind of interesting. I was like, wow, so this is something that it's a feature, not a bug. This is part of basically humanity. Um, but it's just that they didn't know what to label it or put a word on it. And it kind of differentiates in the three different parts though. Your social interaction, your communication, and your behavior. That's kind of how it affects the person or impairs them. So it is the little social cues. It is the up to 70% of communication is nonverbal,
Mm.
and they don't pick up on nonverbal signals. Well, they don't maybe understand hand signals, facial expressions, or react to them as we're socialized to do. So and with that there can also be a language impairment there. They have little difficulty communicating or expressing themselves verbally, and so when they have to do so, they get a lot of anxiety behind that. Some people, they'd be afraid to speak on the phone, or they do little things. One, I'll talk about it later, but one girl, who's diagnosed with Asperger's, said one trick that she would do if she had to like order a pizza or something, she'd, hey, could you call him real quick? I got to make a run. So she'd have other people do little interactive tasks for her so that she didn't have to,
Oh,
face
to
those
avoid the
anxieties.
things
Yep,
that
yep,
she's afraid to
exactly.
take care of. And
Yeah, yeah,
this.
exactly. So that was kind of her way of doing it. And interestingly enough, it was interesting, hearing some female perspectives on it because um, men are 4 times as likely to be diagnosed with
4 times?
ASD. Yeah, 4 times as likely.
Oh,
It affects men 4 times more. And some research, a little brief thing into that, is they think it may have to do with, men, we have more just health issues, period. And like the male brain is more susceptible
mhm.
to, changes. And it has to do with kind of, I think she called it the X, the X chromosome kind of protection thing. Like it's a thing because women have X chromosomes and men have a Y chromosome. There's something the extra that kind of protects women from having certain, genetic things,
Mm,
and vice versa. Differences in men and women,
right.
and even the way that they deal with it is differently. Which we'll talk about a little bit later. But nobody actually knows, the specific cause of it. That's what everybody wants to know. What causes it, but it's not really specifically known. But they do know that maybe like 15 to 20% of the time it is an abnormality, chromosome wise. It is a genetic, it's a developmental disorder. So it, but that is explained but it's not totally explained by that 15 to 10%, 20%, because all of us have genes like that predispose us to things. However, it's the environment. There's environmental factors that have to be there to set that off.
Right. So some type of
You just,
trigger
yeah, there has to be
make
a
that.
trigger.
Okay. Yeah.
Exactly. So we all, man, everybody that's, predispositions, they ask you to do your medical records and your family research and things like that, even if you're adopted for health reasons, just because there's genetic reasons that are passed down. But, that doesn't necessarily mean those genes are going to be activated,
Right.
so they're still doing research into what activates them. But one of the things that, does actually do it is the age of the parents.
Hmm.
And like that was kind of a trip to find out. Like I'd heard that older women, tend to have children, could have children with more health problems. But they're saying that no, men too, men and women contribute equally to it. That the older you are, the more susceptible you are to have a child with, ASD. And so
Interesting.
I was like, wow, yeah, man. So we myth busting around here. It's not all just the ladies; it's men too. You know what I'm saying? So you can wait if you want to, brother. Your risks are going up as well. So, but it could be other issues too that set it off, like an illness during a pregnancy, not like a cold or something, but something that was kind of long term. That was an illness for a while during the pregnancy. Delivery problems, and preterm babies or babies with low birth weight, and so just complications, around birth and the cognitive development, the very early stages of life. It's very important. That stuff matters. And and a lot of people, you have to mention this too, because some people would think that it's caused by the increased rates are caused by or perceived increased rates are caused by vaccinations. And of course that's a hot topic. Getting vaccinated, obviously since COVID and all of that. Now everybody is talking about vaccinations, but some kind of a paper got out there a while ago of linking vaccinations with increased rates of autism spectrum disorder, and that paper has been discredited, retracted. Like I think the guy that wrote it, he got like disbarred or not disbarred. It's law. I think he just lost his medical license. He's not allowed to practice medicine anymore. But again, you put the information out there, and when people are going through stressful times and they're reading something that maybe they're looking for a reason and it's making sense, they can kind of latch on to it. And so it's unfortunate people still, even despite research or whatever, information is powerful. And once it gets in people's head, okay, this is the reason, especially when there's no necessarily known cause they can give you, that's kind of done a lot of damage. But that doesn't do it. If y'all still got vaccination issues, don't blame it on this. There's enough issues. One of the symptoms that I thought was really interesting, well, three of them I thought were interesting because they talked about it in adults. If you have Asperger's, basically that's it's on the spectrum. Basically, it's a stop along the spectrum because again, they used to classify it by itself along with other um, behavioral syndromes, but now it's all under the umbrella of a lot of people with Asperger's are very intelligent people. I believe Albert Einstein had Asperger's. So it's again people we've dealt with. They can be highly intelligent, especially in subjects that they're interested in, but that's one of the issues. They're hyper focused on certain subjects, and so they'll talk with you all day about a certain subject. Call them nerds traditionally, but it's more than that. It can be more than that. This is a person that can have an obsession over anything, whether it be Pokemon, and now they know all the Pokemon, got all the shirts. It could be wrestling, it could be anything. They have an obsession over it that they can talk and communicate about, no problem. However, they can't just switch subjects like that. They're not interested, perhaps, in even talking about another subject. So that causes great frustration, relationship issues, for them. But they can be, again, above average to high IQ. But if you're, on the lower functioning side and just have autism, traditional or classic autism, a lower than average IQ, you won't have as much of an interest or a drive in a single subject to do, the work, the research, and exercise that IQ. And so verbal communication is another one. And this leads to this is one of the more obvious ones because a person with Asperger's or high functioning, they can have an extensive vocabulary, be very intelligent. Again, they're subject matter experts, so they can they're interested in developing communication, but again about certain things, and but as opposed to somebody who has traditional autism, they wouldn't have the verbal skills, to do that, to express themselves. And so again, same thing with vocabulary. They don't have the vocabulary skills to articulate, how they're feeling sometimes, how they're feeling in social situations around others, especially. They can tend to shut down as opposed to a person, again, with Asperger's, more high functioning. They can, again, purport themselves very well in social situations, again, when they're in their element, especially.
Because I
Um,
know for the Asperger's, there's a YouTuber, Tanner Fox, who just
okay.
a couple months ago made a video saying that he has Asperger's, and he's a
Okay.
very successful YouTuber. He's able to do content and be very successful at that, and you wouldn't know that he deals with Asperger's.
Yep. Not at all. Exactly. And one of the guys I found, man, shout out to Dan of the Aspie World. There's a channel called the Aspie World. He's on Instagram and all this stuff too. But he starts it off like, hey, I'm Dan. I'm diagnosed with autism, ADHD, OCD, and dyslexia. You know what I'm saying? And I do this channel, da, 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 da. And and again, he has a very successful channel, a lot of great information and things like that. But on to really talk and be vulnerable like that, to, come out and say, hey, this is something that, I live with, you know, and it's one of those things too. And speaking of that, it's one of those things where, again, there's no necessarily cure for it, or you don't just grow out of it. However, especially with early diagnosis and early treatment, you can get a skill set or set of skills so that those behaviors that you don't have that everyone just normally picks up, you can develop those. And so it's all about again, early detection is the best way for that. And autism, they don't necessarily have the skill sets to do the day to day things, to get up, get dressed, go to work or go to school, do the productive things, that go shopping. Those are skill sets that people are cognitively normal people develop over time and understand the importance of. Whereas opposed, if you're on the spectrum, you don't necessarily understand the importance of those. Now, if you're more high functioning, if you're Asperger's, you can learn those skill sets. You know, you can always learn skill sets. Skill sets can always be improved. Hygiene, brushing your teeth, washing yourself, all this stuff. However, if you're classically on the autistic, then you're going to have help, people to help you go shopping, people to help you groom yourself. You could require a lot more assistance instead of having the capacity, as again, someone with Asperger's, to learn those skills. And so I thought that was, an interesting way of thinking about just life, period. How many skill sets do we just pick up naturally that we don't realize, okay, other people in the world, this doesn't. They don't just pick this up like we do. So it was interesting to think of it like that. And then the last thing too, like the speech delay. So this kind of comes when they're younger. Um, Someone who has Asperger's, maybe they may speak at a normal time and everything like that. Their speech isn't delayed. However, someone who's more classically, autistic, then you'll notice they don't again pick up speaking and communicating like a normal, child would. And that's where most parents actually reach out, and that's how diagnosis happen: is parents being vigilant. They have to be active and involved, in recognizing, what's going on with their child.
Right, and picking up on
You
those
got
those cues as we talked about.
Yeah, picking up, being involved, being an active parent. This is I hope this episode inspires someone out there
Mhm.
to again take a look and be more involved. Now myself as a new father is something I look at, looking at every little milestone my son does, all 2.5 months of him, grabbing onto toys, grabbing onto stuff, looking at everything, being attentive, tracking with his eyes. I'm noticing all these, things happening right literally before my eyes. And so to be doing a little bit of researching on this, I'm like, okay, now I guess I'm gonna be even more vigilant, making sure he's hitting these milestones, man, because that's kind of the hope about this. This is, even again, there's no necessarily cure for ASD, but with early, diagnosis, detection, skill sets can be trained. Those are individualized kind of therapy. Um, we actually work with like a behavioral therapist, and that can be really, intensive. It's actually called applied behavioral analysis, or ABA. And, that can be like 25 to 40 hours a week, literally working with a behavioral specialist, with an individualized program for that child, uh, to get the skill sets that they need to function normally and have a successful and, normal life, to have the best quality of life that they can. And that's all anybody wants for their child, or anybody, is to have the best life they can. And unfortunately, when we stigmatize things, when we call people, the R word, and we just, call people slow and, say they awkward and stuff like that, and just leave it at that, it pushes people further, away from getting the help that's available to them that they need. And that's actually kind of common. Like I said, 1 out of 59 children, and it being 4 times more likely in boys, than girls. We we encounter this. I think maybe some of this stuff might even be hitting home for some people.
Yeah. I mean, just to jump back a little bit, you're saying you were looking at your son and paying a little more attention to detail. You
Man,
know, how is your
yeah.
son? Healthy? Everything good?
Very, yeah, he's very healthy. He's grown. We actually just had a checkup. Thanks for asking, man. Yeah, just a checkup like a week ago. I brought him to the doctor to check his weight because he got a cold. He got his first cold, a few weeks back, and so did the whole house. We all got sick, and so he lost a little bit of weight, and so we just brought him to the doctor to check that up. And he's 11 pounds, growing. He's born at 7 pounds, so
Okay.
yeah, he's getting. You can see it too. He's getting big, man. Um, Again, I think he's hitting every milestone just fine. Again, can track and you know recognize things. He actually is very focused.
Okay.
That's an interesting thing. He will sit there and really watch TV. If something's on the screen, if something you have a phone, whatever it is, he's engaged. He's looking
Oh
at it.
yeah, I
He's
remember when I FaceTimed you and you was just staring me down. I'm like, hey
staring. I'm
man,
telling that's
you
him.
might have a problem. We got an issue. What's
Yeah,
up, my
man.
man?
He can't control those facial expressions quite yet, so he can't smile on
Yeah.
command. But when he does, it's a beautiful thing. But no, it's a blessing, bro. And again, I learned a long time ago working with people with physical disabilities, cerebral palsy, things like that, spinal cord injuries. Back in my college days, I was a PCA. I learned a long time ago, health really is the most important thing, because when that's not there, that a lot of other stuff doesn't matter. And as I said, when my son was about to be born, I turned into every other parent out there, just praying it was healthy, just praying he was healthy. That's all I wanted,
Health
And you
is
just
wealth,
because you're
people.
worried, exactly, yeah. Health is wealth,
And a lot,
and my son is rich. Yeah.
and I know a lot of us, we're very prideful. We don't want to ask or admit that we need help or ask for help much. But
Hmm.
hey, the most important thing is you got to help yourself. You can't help your friends, your family if you're not here. So
There you go.
Take care of yourself first, guys. I mean, I learned that
Hmm.
the hard way. I was always putting people's happiness and other needs before my own. And now when I need, the help or whatever, a lot of people can't be there. It's only you. You gotta take care of yourself and you gotta, fight
Hmm.
through it. So go through it, right?
Yeah.
We all going through it. You're not stuck.
Yeah, man.
You're just going through it.
Straight up, going through it. Action, movement, and that's what it's about around here, man. And so the thing about this subject too, again, some people maybe recognize some things. I'm gonna even go against maybe three things as an adult that you maybe if you see in yourself or others, this could really be something to make you look at. Am I on the spectrum? And there's even online tests, AQ or autism quiz tests you can take,
Hmm.
for this as well, because it's really to help you because at the end of the day, um, it's impairing that person in some type of way.
Right.
They can't have the social interactions, the relationships, you know um and things like that that they would like to necessarily have because of you know something that's actually going on with them. And the more that they learn how to deal with that, the just the better quality of life it can be. Because one of the guys, again, Dan said, the Aspie guy, he said it's like they don't pick up sometimes on the social back and forths, the cues, the skills that we all get, because this is a cognitive thing. It's a developmental thing. And so they're sensing the world differently than we are. They have a lot of anxiety. Everything seems chaotic. We can see everything kind of compartmentalized. Okay, this is a conversation. This is appropriate here. Okay, this goes here. All right, this is what I do here and there. But as a person, if you're dealing, if you're on the spectrum, you're dealing with that, then everything's coming at you so much, it can cause you to kind of shut down, have anxiety, not withdraw socially, you know. That's one of the signs too, if they just avoid those situations entirely because they're uncomfortable maybe with the back and forth of a conversation. Something as simply as knowing when a conversation ends,
Yes. The
you know?
social cues.
The social cues of knowing, again, something that simple that we take for granted, just
Hmm.
knowing, okay, not just what's appropriate to say, but,
Hmm.
um, what's the right distance to be, away from that person. What's,
Right.
those things that, again, we take for granted are can be difficult, for so many people out there.
Yes.
And it's something that we should definitely be sensitive of. And again, if this is something that resonates with you, and when I went through this kind of list of three things, again, shout out to the Aspie world, you said three things to kind of identify if you are an adult with on the spectrum. If you've been undiagnosed, but this is something, hey, you can self-diagnose if you're looking these stuff up. You've been looking on the internet, Googling like everybody does to see, hey, do I have, this or that? um one of the things that was like a dead giveaway was the lack of eye contact, because again, it's socially
You know,
awkward for them.
that's
That
weird
lack
because
of
that's
eye
me.
contact.
That's me.
Yeah, yeah. Like,
When
I
I talk
know.
to
Hold up.
somebody in person, even if I'm like we're here, on the Discord screen looking at each other, it's I don't it's hard for me to look at someone in the eyes as I'm
Hmm.
talking. So a lot of times I'll look down or I look up or away or I'll look behind them. So and people think I'll be lying when I'm talking to them. Like, no, I just don't like looking at someone's eyes. Like, I mean, as much as I like to look at eyes, I don't like to look at eyes while I'm having a conversation. It's weird because
There
it
you
makes
go.
me feel uncomfortable, and I
Hmm.
look away. It makes me look like I'm nervous when I'm not. So
Hmm.
it's just a weird thing that now that you point that out, I'm like, you know what? I do have weird, awkward social cues. As weird and
Again,
outgoing as I am, I guess I have a bit of
there you
both.
go. The spectrum, baby. There you go. So spectrum of all this stuff, because these are behaviors. These are just a set. These are disorders. These are sets of behaviors that are grouped together to make a disorder. But again, we've all on every episode we've done, and this is gonna be no exception. You always gonna like see something that's like, "Ooh, I think that's kind of me."
Right.
So it's all we all in this thing together, people. We're trying to, I guess, normalize this. So again, lack of eye contact, but it was just they'll to the point where they'll again. This guy talks about he identifies people by their shoes and their voice because he didn't look them in the face. Even if they look you in the face, it's not for long. And he says when you're not, doing that, when you're not looking people in the face, then you're not remembering what they look like. He said he has difficulty remembering what some family members look like because actively spend time looking at the top of their head, at their shoes, whatever it is. Um, I was like, wow, that's kind of deep. I said, to the point, like I said, this is an impairment. If you're lacking eye contact to the point where you're having difficulty remembering what your family members look like because you don't look at them in the face enough, there
Yeah,
you go. I mean,
yeah.
it's an
That's wild that
impairment
he could
there.
get that.
Yeah. I
It's
said,
weird
wow,
that
man, that was deep to hear it, like,
it's weird to see the things that what your brain can do to you. Like
mm-hmm,
even people like, for instance, when we had episode on OCD, it's like
mm-hmm,
random weird things, or like it sets people off, or it makes them feel a certain way to the point where they can't
mm-hmm,
move or think. Like it's crazy. Like what I mean, think
mm-hmm,
about it. If I say I can't leave the room because I need to hit the light switch 1,000 times, a thousand
mm-hmm,
20 times before I could actually step out, you'll be you crazy. Like, what are you talking
mm-hmm,
about? Just walk out. Like, I can't. Like, something
mm-hmm.
bad's gonna happen if I don't do it. Like, like it's crazy.
Yeah. Big, and it can become so ingrained that people don't even realize they're cognizant of doing it because they've done it so much. And one example of that, I was watching a little documentary, again, sidebar, kind of, but watching a little documentary on Chris Farley, man. The great Chris Farley, man. Beverly Hills Ninja himself. Man, that dude was too good, too funny. But one of the things they talked about, he had really bad OCD. I don't think he had medication on some, but it was something that was kind of obvious to people that, kind of knew him. After a while, you got kind of used to his like kind of ticks of like he'd do something real fast or jitters, and he was kind of a funny physical guy anyway. People just took it, you know, for granted. But they were doing one thing where they were looking at an old scene of Saturday Night Live. We were walking through the hallway, and one of his friends says he touches every picture on the wall, on the hallway, on each side. He touches it. And he's doing it like, and again, people that are around him have seen him do it. They're not realizing now he's on camera and it's just automatic. This man has, certain routines. And again, that's one of them. So again, lack of eye contact, that's one. Difficulty with social conversations. Again, we kind of went over that too. Social rules, unwritten boundaries, um, things like that. When get conversations in, all that stuff. But then again, number three, a rigid routine and like lacking, they can't deal with change well. So it's like these would be people that literally are strict to their routine, wake up at the same
Mhm.
time, eat the same thing, sit in the same spot, in the same clothes. Like they're afraid to break their routine because when something does happen, if something doesn't go according to plan, something interrupts that routine, it
Mhm.
throws them off. They can't like function. They can't have a good day now, because they don't deal with change well,
Yeah.
you know. Exactly. They don't like the spontaneity. They don't like, because that's part of the social anxiety, is because people are unpredictable. So they like to have stuff that they can control. They like to be in an environment that they can control and don't have to worry about change and deal with an anxiety of that, you know? And so I was like, man, that's kind of deep, because I thought of myself, I'm a routine two guy. I'm definitely a creature of habit, but I thought, nah, man, I deal with punches pretty well.
Yeah. I mean, for me, it's I this is similar to that, but I know that it's not dealing with what we're talking about right now. But I hate
Mhm.
change myself. Like it
Yeah.
bums me out to the point where it wouldn't affect me. Well, it affected me in a way where it's like I get depressed because I like how things are. And especially when growing up, I first noticed this when like my good friend moved away. And it bummed me out so much to the point where it's like
Hmm.
I didn't want to do anything. Like that depression kicked in. And then so as I got older, we, all friends gotta go to a different class. You got a different teacher next year. And it's like, no, like why? Like it really bugged me. And then
Hmm.
until as we get older, and each time I had a friend move away, switch jobs or whatever, move to a different state, it just really bummed me out. It takes me a long while to get used to the fact that hey, my don't live here no more. Like I can't just go
Hmm.
down the street and visit them or something like that. It just bums me out. Probably not the same thing, but it does affect me to the point where my mood switches and that's just depression.
Hmm. No, hey man, dealing with loss. My boy James Bresky, he talked about that. That's one of his, things, dealing with, a lot of loss and death early in his life, losing friends and stuff like that. It has an effect. It can be frustrating too, because you can see a person is like, don't you want to do something else? You can grow, you can get beyond this, but they maybe have something else going on, behind that. not just laziness or not just wanting to. Maybe there's again something deeper.
Right.
So things to consider, man. Things to consider. But one of the things too I thought was really great was, it's if it's um like a long time ago, I was thinking about being a teacher for like a hot second. So I did like substitute teaching, like right at the end of grad school. So I was like 25 or something like that at the time. Still growing my locks and everything. So I had this big old fro. And and especially in Minnesota, I didn't even have a black, especially male teacher until I was like in college, like grad school. So me being any type of authority figure, this young black dude in the school, these kids just reacted to me a little different. I was working with special needs kids. Some of them were on the spectrum, obviously. But one of the things that they said that I learned from that, which was kind of reinforced by this research, is when they're having, children that are having a difficult time already socially adjusting, and it's frustrating to them because they want to, act normally. They want to, you know, um, they want to interact and they want to be doing a good job like anybody else does. And it's when you keep on coming to negative statements with them, oh, don't do this, don't do that, stop this, stop that. One thing that they taught, me briefly in the school thing was instead of if a kid was running down the hallway, don't say don't run because the last thing they hear is run and don't, and it's all negative. Say walk, say what you want them to do. So do based language. So walk, so they're
It's
hearing
pretty
actual
interesting.
instructions, you
That makes a
know.
lot of sense, actually. I was just
Yeah,
thinking that.
because they have difficulty following instructions.
Yeah.
People, that's another aspect of it too. Yeah, because it's one of those things too. Again, quick tangent on this. When you tell somebody with, it's on the spectrum, bending over backwards or putting yourself in someone else's shoes, those graphical images, that we have aren't, we understand what people are saying. They literally will see somebody bending over backwards or putting shoes on another person. It doesn't compute to them even,
Right. They think it's actually
the same
saying what
way.
you're actually saying.
Yes, exactly.
It's like
So,
talking to
like,
your girlfriends.
there you go. And it could be very frustrating. Again, like, let's say you have a partner and they're trying to give you some instructions to go do this, or they're but there's sometimes people that need to make a visual of it, draw a picture of what they need to be done
Hold on. Let
because
me take that back before I get roasted. When you're talking to your significant others,
and it's just a disconnect. You
yeah.
feel like you guys are talking two different languages.
Now, like
Well,
when
then,
girls say, I'm fine, what does it really mean? Is the question of the century.
man, yeah, I'm learning. I'm still not doing well with that. But
Yeah. It's an
but
ongoing course.
for sure, for sure. So, but I did like that again. Tell them what you want them to do instead of don't um, don't hit your sister, don't hit your classmate. Tell them practice safe body, like something positive.
Like trigger
That they
words. They
know.
can have trigger
Yeah,
words
trigger
for it.
words or whatever, but that are
Pineapple.
do language.
You know.
Yeah, what I'm saying is more. Again, it helps them, understand, and it's a positive thing. Okay, there's something I want you to do. Not stop doing this. Stop doing this. This is bad. Stop. That's don't do that. That doesn't help.
No, and
So I thought that was really interesting.
whoever's listening, if you guys do deal with, Asperger's or whatever, let us know. We want to hear from you. You
Yeah,
want
for
to
sure.
know, what I guess, it is
hmm
to live with it and see what tips that
hmm
you may have that works for you, might help others. You know, just let us know. Share your story.
For sure, man. Hey, man, it's about the people out here. So, and then another one, and I think this is good for all kids, but to add structure. Add
Hmm.
structure. Kind of like a reward system to the kid's life because they don't necessarily aren't as concerned or care about the things that we normally would be socialized to that they would just pick up. Again, they can be
You know,
very particularly interested in something,
it's
but
it's
you have to teach them give them incentivized to do, normal skills,
it's.
raise skills that they don't have naturally.
I'm happy you brought that up, structure, because that goes not just with people with Asperger's or ASD. It's everyday life. If you deal with
hmm
anxiety, we talked about before with anxiety, is like it's always good to have a routine. And for me, a lot of times, ever since we're kids and growing up and in school, what is it based around? It's based on around a routine and a structured day. Everything laid out. You knew what first period you had to do. You know what time first period was. All that. You knew what you had to do. You had like a routine. You go to school, and then if you're in activities
hmm
after school, that's what you would do. You'd go home, you do your homework, eat dinner with the family, and then play games or whatever. And that was
Mm-hmm.
steady. And as you get older, when you're out of school now, it's kind of on you to figure that routine yourself out and structure your life now. And a lot of times I found myself having and dealing with anxiety because I had no structure. It was
Mm-hmm.
just everything was so random that I was so used to being, oh, that's how I am. I just go with the flow. For most people, it might work, but for people that deal with mental health and anxiety like I do, I need structure. I need routine because when it's just whatever now, I feel like it's overwhelming. It's like, oh, I gotta do this, gotta do
Mm.
this. Do I do this first? How do I do? Like how do I get here? And it's just too much. And I start getting anxiety attacks, and you get stressed out. Now your moods change, and it's just snowball effect. So structure is a very nice thing for everyday life too. So if you're dealing with anxiety and stuff, you know, focus and structure your days and see how that goes.
Yeah, man. Hey, like I said, I learned a lot, just doing the research on this, and just enforcing a lot of good habits. Because another thing it says too is to model the behavior, because
Hmm.
the way that the best case scenario is, again, is, from vigilant parents, going, if they see something, in their child, and trusting your instincts as your parent, your child, if something's off, things aren't going quite right, bringing that attention to the physician, then they, can present, have tests that they can go through, to get you the behavioral specialists and stuff in time, again, to just bring up a skill set to get other behaviors, that other children just have naturally. This child just needs to work on those. But once you, have it, then you're able to live, again, better quality of life just like anybody else can. I thought, like I said, shout out to the Aspie world, shout out to everybody, out there who's really, living with this condition, but still showing, that you got a life, having a girlfriend out there and having a life, and hey, I have doing all this stuff. And that gives hope to us all, that who our fellow people going through something just like this, even if you don't have the SD, you're not on the spectrum, same thing, because I like how you said too, I'm diagnosed with autism, ADHD, OCD, dyslexia. I was like, okay, so we all got some problems, and a lot of times, again, we'll get into it maybe on another day, because there's so much to talk about, even with how women deal with it differently. Because again, men are 4 times more likely, but a lot of times because of that, women go misdiagnosed, and they're more just so naturally more better with social cues and just higher functioning with it. So what they do is mask. They just do an imitation of something. They think they're, getting along socially, but no, they're actually just going through a routine to go along to get along. And as opposed to boys who get more frustrated and just can't go along to get along, we're just not as socially, cognizant as women are. So it's just a lot of interesting stuff, man. And but so yeah, I hope somebody got something out of this. I know it was a topic that, I debated on whether I should do or not, but I really think it does kind of fit right in with everything else we kind of are talking about. Other people going through it, my fellow peoples. So yeah, man.
That's all you got
Um,
for us this week?
uh, yeah, man. That's kind of all I did, man. I thought that was. Hope I gave out some pretty good information. Um, I'm not trying to overload people's head with it. Like I said, if we need to do a follow up, maybe I'll do a part two. Again, speaking about the differences, that there are in women with it and how that manifests. And then also, again, we spoke about narcissism, and it's characterized by a lack of empathy. But
Hmm. Yep.
if you're dealing with somebody on the spectrum, they're having an issue too, an empathy issue. You know,
Right.
but it's different. It's not necessarily a lack of caring or just pure not feeling it like another person, or feeling that emotion, but not understanding it. They can feel somebody's emotion, but just not empathize in the understanding or intellectual way. Like they could really genuinely be like, "I'm sorry you feel that way," because
Right.
they don't get,
They
you
don't
know,
care. Oh
yeah, no,
man.
it's not just care, but no, it's just a genuine thing. They feel as well, but they
Mhm.
just don't have the same capacity,
All right.
for that skill set that we naturally do to intellectualize it as well. So, whole nother, yeah, man. I got into some nerd stuff with this topic, man, but it be like that sometimes.
Well, let's might as well just get into that mental break because I kind of need it. That was a lot of
Yeah,
good
man, heavy
info.
stuff, a
Yes,
lot of
sir.
info, man.
Let's switch gears a little bit.
Brain
Lighten it
busting.
up. Let's see. Question of the week for you, Mr. Eric. Top three drinks or beverages.
Okay, top three drinks.
Yeah, we
We
could be.
talking.
It could
We
be
talking about adult, or
alcoholic
we talking
or
about
whatever
okay,
kind of drinks.
okay. That's a broad one. All right. you know what? I'm gonna go with because I get it when I'm at the movie. Still, I always love ices.
Ices.
You
Any
know,
particular flavor?
yeah. To ices, no, I always mix them. I
Oh,
get the cherry and the white. You know, red, white, and blue. That thing, American flag it.
get all patriotic.
So yeah. So I don't drink those as much as anymore. You know,
Yeah, that's
getting older in the age, there's a lot of
that
sugar.
sugar.
Like I said, that's got to be at the movies or something for me to get one of them.
It's a special
But
treat, right?
exactly, definitely. Um, and then I guess whiskey sour is my go-to adult beverage. It's,
Whiskey
I'm a
sour.
dark
Now,
liquor man.
I don't
Whiskey
know
with the
too much
sour
about my
mix.
drinks. What's in a whiskey sour? Like, what does it consist
Okay,
of?
whiskey or bourbon. That's just the dark liquor. Whether it's Jack Daniel's, Jim Beam, something like that. That's what people kind of know. Maker's Mark, all that stuff.
Yo,
But then
Maker's Mark.
sour mix. Yeah, sour. It's just kind of like it's got like a lemon lime mix. You
Okay.
know, yeah, it's just a
Okay.
lemon lime mix. So that kind of I got on that in college, man. So shout out to the
Okay.
track team days.
Sounds like such a sophisticated drink.
Yeah, whatever. I did. I was like a freshman when the senior showed it to me. So yeah, there you go. Maybe it stuck with me. Whiskey sour, and then I'll probably say I really like apple cider.
Apple cider.
Yeah, apple cider, man. Like
Go-to
a good
drink?
apple cider. Like, okay, I guess with like favorite, not like go to. Man, my go to drink is water, bro. I drink
You
water.
know what I mean? Like,
And
yeah, that's
okay, you know
top
what? They're not
three
apple
apple
cider
cider.
because you know what? In the wintertime. So let me
Okay.
take that back. In the wintertime. So I'm gonna just say regularly. Then I go with usually the great Powerade, man. At places I just get Powerade. Like that's what I drink. Like if
Great
I go out to the
Powerade.
restaurant, like getting fast food or whatever.
In
I
particular
usually
reason why grape?
purple, man. Love purple.
Oh, okay.
And Powerade in particular because that's what the machine we had at my high school. Some people had Gatorade machines.
Oh.
We had a Powerade machine, so I grew up drinking Powerade.
Alright,
So not a Gatorade guy, Powerade.
nice. And there's always
For
the
sure.
same Powerade. There's that Blue Mountain, whatever, the blue
Oh
color.
yeah, the blue one. Hey man, again, the red, white, and blue can't go with that. Wrong with that either. Especially that white cherry when you can find it.
All right, interesting.
Yeah, man.
Very interesting.
For sure.
As for
What you got?
me, it
You
would
got like
go on
a
alcoholic beverages or
you got
whatever.
like a fried squid or jerky squid of drinks you gonna pull out on me?
Nah, it's one for me. I'd say if it was alcohol beverage, I was a Coke and rum,
Okay.
rum and
Rum and
Coke
Coke.
guy.
Yeah. Rum and Coke. Yeah. Classic.
Yeah, can't go wrong with that. I think that was one of my first drinks I've ever had was a rum and
See,
Coke.
see that does it.
Well, I
Sometimes it
take that
stays
back.
with you.
It was Hennessy. That was my first drink.
Oh wow, you was hanging out
Yeah.
with them,
Yes,
huh?
them. All my friends. Oh, Hennessy. I'm gonna say his name.
Oh my
Jack,
God.
2, and Matt, my brothers. Hennessy. Oh man, so many memories.
Or lack thereof. Yeah.
And for my buddy Jack, if I'm gonna make him listen to this episode, I'm just gonna say New Year's at 2's place. That was great times.
If you know, you know.
But yeah, and then my other one, I was oh man, Diet Dr Pepper.
Ooh, you know what? That's probably
I'm telling you,
that's up on that list for me. I
that's the
love Dr.
only
Pepper.
diet drink just that tastes just like its regular counterpart.
True.
Deliciousness.
Mhm.
And my last,
Facts.
my my other go-to drink is I keep it simple. It's a jasmine milk tea, boba tea.
There we go. All right. I
Yeah.
knew we was gonna get something Oriental in there. All racial.
All my boba tea drinkers.
Bubble
What's
tea. Yeah.
up?
Shout out to the bubble tea gang.
But yeah, I
I
mean
ain't had
that's
none in a minute.
you need to try, jasmine milk
Yeah.
tea or golden milk tea is my
Okay.
recommendation.
Yeah, there's a place. I already know the spot. Yeah, last time I got some bubble tea, it's just been a minute. So
Yes,
I'm in the
sir.
mood for it, man. Maybe I'll do that tomorrow since it's hot. Like I said in the
The
beginning,
weather is not playing around. It's
joking
been
on that. So,
humid.
and that being said, y'all stay safe out there because it's hot everywhere. So
Stay cool, stay
please
hydrated.
stay cool, man. Stay hydrated. And thank you for joining us on another episode of the Consider Your Mind podcast. Could have been anywhere in the world, but you were here with us, and we do appreciate you. And we will see you next week. Peace.